Welcome back. We're thinking spring this morning. Maintaining good eye care is especially important when the weather starts to turn warmer and the pollen starts to fly. Optometrist Gina Wesley is here with some timely tips for your peepers. Good to have you here.
Nice to be here. Thank you.
You do a lot of presentations and you meet with a lot of people. What's the biggest and most common misconception here in Minnesota about eyes?
Here in Minnesota, I always like to stress the fact that people don't think they need UV protection year-round. And we actually get quite a bit of UV exposure in the winter, even though we're not outside for extended periods of time. That snow has a lot of reflectance. So I need to stress and make sure that people protect their eyes all year round.
You brought in an eye for us to kind of show what's going on and tell us a little bit about what this is.
Okay, so this is just a small diagram model of the eye here, and I like to show all the different parts and show people that the sun can affect not only the front of the eye where the cornea is, but behind the iris is the lens of your eye, this little clear one right here. And that's where people get cataracts. And if you get a cataract, it can cause it to be a little bit cloudy, and it can greatly affect your vision. The sun can also affect the back of the eye where that little red spot is right there. That's your macula, and that's where you get macular degeneration as you age, and UV exposure can have a great impact on the chances of you developing that.
So very critical to protect your eyes.
Absolutely.
One of the ways to do that, sunglasses, and we go into springtime and pollen is such an irritant.
Right, absolutely, and sunglasses can help from protection from pollen getting into your eyes as well. And as we approach the allergy season, some things and tips I like to help people out with is what's some non-medicinal ways that we can help prevent those allergy symptoms from happening. Sunglasses is one. You certainly can switch, if you're a contact lens wearer, to wearing a daily disposable contact lens instead of your regular longer wear lens.
So it's important to get rid of it because there's all that goes and sticks on it.
The solutions you use are another thing with contact lens wearers. For even the non-contact lens wearers, simply going to bed at night and taking a shower and washing your hair before your hair that has all those pollen and allergens rub all over your pillow and then all over your face, that causes those allergy symptoms to be worse. Simple things like that can really help you out. When
you have just, let's say you don't use contact lenses and you don't need corrective lenses, what's a good way to clean your eye?
A good way to clean the eye, is you can use a natural tear product to flush it out. You certainly can
different
also,
examples here, right?
And I've got some different examples of some allergy eye drops as well as some high quality artificial tears. The tear is going to be the most sterile and best way to flush that eye out, because if you flush your eye out even with just water from the sink or shower, you could be exposing your eyes to some bacteria.
Why, as we age, do some of us have more problem with tearing? Do the ducts get clogged?
Well, that can happen. They certainly can get clogged. There's also some hormonal changes that can affect the tear quantity and quality. There can also be changes in the oil glands that are right along your eyelashes, and the quality of those oils coming out needs to be monitored, and there are many strategies and things that can help you there.
The type of sunglasses that you buy, does that matter?
Yes, absolutely. First of all, you want to make sure you're getting the 100% UVA, UVB protection. The other thing is you want to get a good quality sun lens. I have some patients who don't like to wear sunglasses because they feel they can't see as well when they're wearing them. Well, it may be because you have a poor quality lens that has lots of distortion.
So it's like an example of you get what you pay for very often with some of this stuff.
That's exactly right.
Very good. Thank you for being here today.
Thank you very much.
Very timely. For more information about any of the tips that Dr. Gina shared with us this morning or her practice, check out our show page on care11.com, then click on the News tab.